Hi, my name is Rita Nutt, and for my speech I would like to talk to you about thyroid disease. I wanted to inform you on the most common problems of the thyroid, the symptoms of them, the testing that they do for it, and the treatments. Now, what is your thyroid? Well, your thyroid is a small gland. It's butterfly shaped, and it is located at the lower part of your neck. Now, the function of the thyroid is to secrete hormones. Now, the hormone that's secreted through the thyroid, it sends energy to the cells of the body. Now, 2 years ago, I was diagnosed with thyroid disease. It first started with a goiter in my neck, which is a large lump, and what they did is they looked at it, and it was a little too big to monitor it. If it's smaller, they'll usually monitor it, maybe treat it with medicine, but what they had to do for me is I had to the testing that they did on me was a radioactive uptake scan, and what I had to do is take a dye in my body, and they did a CT scan, and what they were trying to do was rule out cancer. Well, they weren't able to rule it out with that test, so I had to have a needle biopsy, and what they did was they numbed my neck and they inserted a needle, pulled out some tissue, and went over that, and they still could not rule out the possibility of cancer, so I had to eventually have surgery. And they took out part of my thyroid. They took out the right part of my thyroid, and now my treatment is I have to take a thyroid medicine every day for the rest of my life to replace the part of the thyroid that they took. It was a very simple procedure that they did. I have just not a very visible scar at all. So I wanted to share that with you, and that's why I decided to talk about thyroid disease, because I had no idea even what a thyroid was until I got diagnosed with it. So I thought this would be real good information. It's very common in women to have thyroid problems. Some of the symptoms, some of the most common problems that can develop are hypothyroidism, which is an underactive thyroid. Then there's hyperthyroidism, which is an overactive thyroid. There's a goiter, which is an enlarged thyroid, is what I had. Then there's thyroid nodules, which are lumps in the thyroid gland. Then there's thyroid cancer, which is malignant thyroid nodules or tissue. Then there's thyroiditis. Now, then there's I want to talk to you about the symptoms of them. Now, if you have hypothyroidism, you can have fatigue, weight gain, low blood pressure, fluid retention, depression, even body pain. If you have hyperthyroidism, you can have anxiety, insomnia, high blood pressure, high heart rate. You can even have vision problems. Then there's an autoimmune, which are two diseases that directly affect the thyroid, and that's Hashimoto's and Graves' disease. Now, I had the Hashimoto's disease, and what that is it rotates between the hyperthyroidism and the hypothyroidism. Then the Graves' disease typically mirrors the hyperthyroidism. Then you have your goiter and your nodules, which are swollen, tender, tightness in the neck, hoarseness, coughing. It's usually visible. Then you have thyroid cancer, which is a lump in the neck, voice change, hard to breathe, hard to swallow. Then we have the thyroiditis, which is the pain and tenderness in the neck. Those are the symptoms of the most common problems of a thyroid problems. Then I want to talk to you about the testing that they do. They can do blood tests, they can do thyroid imaging testing, and then they can do biopsies. On me, they did a biopsy, and they also did an imaging test, and those are just outpatient procedures. And then I wanted to talk to you about the treatment that they have. One of the treatments is surgery, which is what I had. Another is medicine. They can just give you medicine and try to see if it works out on its own. If it's a small goiter, then they'll just monitor it. I also wanted to let you know that it is very treatable. It is common. It's a lot more common than people think that it is. When I got diagnosed and went through the process of getting mine taken out, I talked to quite a few people that had it, and I had only talked to one person that actually had the surgery. Most of the people, they just monitored it and used medicine, or they did radioactive treatments on it, and it got rid of it. But I did find out that it is real common in women. If you have trouble with weight gain, or you have trouble losing weight, or you having trouble, it affects your metabolism. So if you're having trouble with your metabolism, it could be your thyroid, and you might want to get your thyroid checked out. Now that you're aware of the signs and the symptoms of the thyroid, and what it can do, and the possible effects, and that way you can be more aware of it. And if you have any of these symptoms or problems, then you can go get it checked out by your doctor. Do a simple blood test. They just check your hormone levels. And I just wanted to let you know that just because it is common, it is very treatable. Thank you very much.